information. My name is Lee, and last June I turned 65. And I woke up one morning. It was literally overnight. It felt like it hit me, but I had symptoms, pain in every joint, swelling, uh, inflammation. It felt like my hands were on fire. I was very weak, fatigue. Um, and as an example, I couldn't twist off the top of a water bottle. I didn't have the strength, or the pain restricted me from doing it. If I was sitting, I needed help standing up. It took me about a week. I kind of self-diagnosed it because I kept thinking, this is not a flu. This is what is with this body ache? I felt like I got hit by a truck.
But it
And
happened really fast on you, right? It
it,
happened kind of seemingly out of the blue, happened really quickly.
yeah, over the weekend, I was watering the garden and working on lawn work and putting in a full day and no symptoms, and it seemed like it was overnight. Um, but within a week, I was able to get into my doctor, and I told him that I believed I had Lyme's disease, because it certainly matched what I had researched about it. And he uh, he responded that he didn't think I did, but we would do blood tests and find out what I do have. And sure enough, the blood test showed I had Lyme disease, and they retested, and again it was positive. So they put me on the. He explained that the procedure is put me on 4 weeks of antibiotics.
Hmm.
So I was on antibiotics for 4 weeks. It did not improve. Um, so he gave me a fifth week. And so I had 5 weeks of antibiotics. Um, and at that
So,
time, he said there's nothing more that he can do for me. I mean, he recommended Tylenol and ibuprofen for the symptoms, but that wasn't going to help me.
so you had this acute onset, went to the doctor. It still puzzles me that they didn't think it was Lyme, but they at least ran the tests and they found Lyme and they gave you the correct, by the book treatment, which is the doxycycline. They did it for the recommended time, which is about a month, even a little extra. We now know based on research that that protocol, even when it's applied fairly quickly, in your case it was, has a 80 to 90% success rate. That's different than 100% success rate. So, we really go, okay, you're one of these maybe 10 to 20% of people it didn't work.
Yeah,
And this is where we go. They don't have a good level 2. If the level 1 doesn't work, you just start to slip through the cracks of the system and your doctor looks at you like, I don't know what to do with you.
that's exactly right. My backup plan was, um, I'm going to Mayo, because Mayo's on
Right.
the Mayo Clinic's on the cutting edge of everything. I proceeded and contacted the Mayo Clinic to make an
Yep.
appointment. They asked me to first send the doctor's records so that they could review them. And they reviewed them, and they contacted me by phone and by mail to tell me that I was declined. They explained that their protocol is the same as what I had. They would give me 4 weeks of the antibiotic that we discussed, and since I had already gotten 5, they're saying there's nothing more we can do. We're not going to waste your time or the hospital's time, because my local doctor did everything that he could do. And so at that point, I was scared. I was angry. I was desperate. I got depressed. My sister-in-law, uh, heard our plight, and she had a niece that was dealing with similar situation, and had gone to Dr. Warren and at RHS, and was having success. And so I contacted you.
This was now the fall, right? So
We first spoke mid-August, once I learned of your practice, and we had quite a long, in-depth interview, so that I could lay out exactly what I was feeling, and I gained a lot of information from you as well. And I will be honest. I was skeptical. I was doubtful, but I was desperate, and
yeah.
you were the only one that offered me hope. And after hearing my symptoms and so on, um, you were comfortable, and you made me comfortable that you could bring me improvement.
But so we started somewhere in the fall.
September 1 was when we actually started. Prior to that, mid-August, we talked on the phone. We got set up. We did the blood testing, and you had informed me early on that I was one of the lucky ones that not only had Lyme's, but the tick was also carrying a second disease, Babesia.
Yeah.
Yeah, and that led to some of the problems I was having as well, or I should say, it complicated it. And looking back at it, I'm extremely impressed. I don't want to get ahead here, but the scientific approach that you took, and RHS, you knew exactly what I was dealing with, and by me, the more information I gave you regarding the symptoms and the changes and so on, you were able to cater a program for me with the particular supplements. And mid-October, uh, about 6 weeks later, I was slowly seeing improvement. And by improvement, I mean the swelling started to go down, the inflammation started to improve. It was slow and gradual improvement, but it was obvious improvement. And then you and I had an appointment actually on Halloween, and we were able to talk about more about what was going on, and did continue to improve. Like I say, it was slow and gradual, but it was obvious and consistent.
You hadn't been sick that long, so in general, when the shorter it's been, the faster you can get better. But the more things you have simultaneously happening, it slows you down. But also, it's about this, you take a basic outline and I have to kind of customize it for you.
Right.
So as we're going through the process, I check in with you every, it's usually every 2 months, 2 to 3 months, and I'm trying to make adjustments based on, how your body's doing with it.
That's exactly right. We met again in January, early January, and by then I uh, was able to explain that I have continued improvement, and how far I had come during that period. Um, and there was a little bit of change in some of my symptoms. And so you made a few changes to my supplements that I took, and um, by February, I was able to go on several trips with my wife. I certainly wasn't 100%, but boy, I was feeling so much improved that, I mean, there was a lot of walking, a lot of hiking.
Big step when you can start participating in some of those things in life. I remember you were excited, hey, I was able to do this. It went well. That was good. Once again, those as you gain function, you can go live your life more. And that usually tells me it's going, we're on the right track as you're doing those things.
Yes, yes, and I did indeed follow the protocol religiously. The twice a day, and I think that's important. Or I certainly found it important in my case.
Yeah, I do
And
everything I can to try to make it easy. I started with a doctor who did 5 times a day, really intensive protocols. And I found twice a day works really well, and it's a little easier to do because I'm trying to balance something that can really work, but I really want it to be as easy to pull off because you got to pull it off consistently for some time here, right, Lee? I mean, it does take some discipline to make sure you're getting it in consistently over months.
Absolutely. Now we're at 8 months, and I feel like I'm 100%. Um, I'm very, very grateful. I will continue to be frustrated with the medical professionals because Lyme disease has been around for a long time. Correct me if I'm wrong, doctor, but
Yeah, it's not new. It's not new.
to me, it's embarrassing that they're unable to help the like you said, the 10 or 20% that are not helped by the antibiotics. And when there is something out there like the solution that RHS has, um, I just think it's very unfortunate that they don't at least inform the patient of some of the other options.
Yeah.
And that's kind of what I'd like to accomplish today. Is I want to let people know that there is hope.
You're back to doing everything pretty much now, Lee, right? I mean,
Yes, I truly am. Like I say, I turned 65 a year ago, about the time this happened, and we've got a big backyard, a lot of landscaping, a lot of cleanup to do in the spring, all kinds of chores. I'm active. My hobby is woodworking. Um, and I built my own deck, and I mean I take pride in my health. I can honestly say now that I'm in better shape than I was prior to the tick, because it's when your health is taken away and you get it back, you appreciate it that much more. And so um, you know
absolutely, Lee. Yeah.
daily exercises and bike riding, and I'm trying to be a teenager again, and so we'll see how that goes. But at least I've got the opportunity.
I'm really excited for you. And I just wanted people to hear your story because we talked about that, that 10 to 20% fail rate. Lyme disease hits about 500,000 people a year. We think 10 to 20% are going chronic, which is a lot of people. That's 50 to 100,000 Americans every year who really aren't having a great solution, depending on exactly which stats you're pulling. And I don't think your story's uncommon. I think it's actually a huge crack in the current medical system that many people are suffering and falling through. And I'm just happy that you're better now and that you can, have the health to go live your life, Lee.
I'm extremely grateful. And like I told you, I feel like you saved my life. Obviously, I was going to continue to exist, but my quality of life, I uh, I can't thank you enough, and I would recommend your service to anyone that is struggling. There is hope.
Awesome. Thanks, Lee. Thanks so much for sharing your story with everybody today.
Thank you.
Yeah.